The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Hello everyone, welcome to Health 180 with Carion and Fenn. As we journey through the unknown of COVID-19, we're faced with a new reality of social distancing, isolation, and a need for medical information. Today I'm speaking with Alec King from the Canadian Mental Health Association Durham and Leslie Motts from Lakeridge Health. We want to explore COVID-19, anxiety, mental health, and medical care. So let's learn together. Joining me via Skype is Alec. Welcome to the show.
Hi, Carion.
With everything that's going on, Alec, what would you say to someone who's feeling anxious about COVID-19?
Well, I mean, in this kind of situation, anxiety is very, very natural. I mean, we're constantly getting messages about staying inside, being careful, being cautious, and to be anxious is a really natural reaction to that. I think what people have to do is we need to kind of take a look at that and kind of see where that anxiety's root is and find out what exactly about it is bothering you. And then when you look at that, you can kind of start working on that exact issue.
So for the average person who doesn't know what anxiety is all about, what are the symptoms? Like, what are things that a few things that people can look out for that would tell them that they might have anxiety?
Well, I mean, anxiety is a perfectly normal kind of human emotion that people can feel, and it can be things like feeling nervous or restless or tense. If you feel worried or unusually scared or concerned about something like that, you may experience physiological responses like having an increased heart rate, breathing rapidly, sweating. You may feel weak or overly tired, and it might start to affect your everyday life. It might change how you interact with people or things around you. And when it gets to be the point where it's inhibiting the way you operate and changing the way you live your life, then it's a good time to maybe think about reaching out and looking for help, talking with a mental health professional.
So how can you support someone who's anxious about COVID-19?
Well, in that kind of situation, it's good that you're talking with someone and making sure that they're safe. Make sure that they're not. We always look at this from perspective as you want to make sure the person is not in any risk of any kind of harm or anything like that. And after you've talked about that, after you've figured that out, the next thing you want to do is listen to them and find out why exactly they're feeling. Just listen to what they have to say, and then kind of talk about what exactly that is. So you can let them talk it out and use kind of non-judgmental phrases to hear exactly what they're saying and let them know that they're being heard, which is really the important thing. And then without kind of guiding them or judging them, you can talk about possible solutions, maybe things that might help them feel a bit better.
You know, one of the things that I find that's happening is other people making you anxious. Like, how do you deal with that?
I know exactly what you mean. And I mean, one thing that we run into a fair bit is that sometimes the other person isn't a person, it's social media. And we find that people are social media is this fantastic thing where it allows people to share all these ideas, but sometimes those ideas aren't necessarily the most productive or useful. So we're telling people that you should try and minimize the amount of time that you spend on social media looking at things like that, looking at things about the pandemic. Because even, if you just control it so you're only looking at news from reliable sources for a very set period of time each day, it'll help reduce your anxiety and calm you down around that kind of thing. But in terms of dealing with an individual, someone who's making you feel anxious, that can be something that can be a very personal kind of reaction. So when you're talking with that kind of person, you want to think about what you can control in that scenario. So the idea is, what about that interaction with that person is making you anxious? And when you can realize that, then you can kind of focus in on that exact point. So it could be that if someone, in this instance, when someone's talking about the pandemic, most of the time when people come to talk to me about it, they're in fact just expressing their own fear. They're not trying to make me anxious or get me worked up or anything like that. They're more or less telling you, I'm scared. So if you change the way you interact, if you kind of focus on what you can control of that interaction. So if someone comes to you and says, oh my God, I heard, and then some terrible thing, because there's so many terrible things coming off of Twitter and everything like that someone could be echoing. So what you can say is, that sounds really scary, and just let them know that they're being heard and understood, and then kind of work from that, as opposed to getting everyone amped up and kind of, talking about how horrible things are. You just say, that sounds scary. And then you can kind of shift the conversation into ways that are slightly more productive, things that make you feel a bit more calm and centered, maybe things that are in your sphere of control that you guys can influence.
For me, I'm having a hard time pertaining to my children. My 10-year-old is always watching videos on YouTube, and my older son, he's asked to go out a few times, and I'm like, if you leave the house, you can't come back in. You're locked out, right? So how do we talk to our kids? Like, this is a very difficult time, and we have to find a way to be able to communicate properly to our children so that they feel safe. How do we do that?
Absolutely, and a lot of that is based on the age of the child. I have a 3-year-old, and she has just such an extremely limited understanding of what's going on. She just knows that we can't go out and do her favorite things. So we try and take that day by day and just explain to her as best we can. We just say it's closed because we're keeping people safe. And she gets that, and she can appreciate that. We don't have to get into a larger picture that could possibly scare her. But for older kids, I have an 8-year-old as well, and for them, you want to find out what they know before you get into telling them about things, because you don't want to provide them with information that could scare them or they're not ready for. So it's very much like we're dealing with an anxious person, where you sit down and you let them talk. So you let them tell you why they're feeling anxious and what they're worried about. And that could sometimes be some scary things. Like, kids will talk about this, and they've seen things like The Walking Dead or stuff like that, where they assume that this is one of those scenarios. And you have to let them talk that out. And once they've expressed that and kind of got that feeling, a lot of the time that can be a huge step for them on its own. They feel like they've got that off their chest. And then when you, the adult in their life, the person who they look to for support and caring, can tell them in a gentle, non-judgmental way that this isn't that scenario, that you are doing everything you can to look after them, that the people, smart people, scientists, doctors, are doing everything they can to look after us, then they feel heard. And at the same time, they know that this is a scenario that won't be heading in that kind of direction. And at the same time, kind of work with them around what they can control. Because if kids focus on the huge picture when they already have such a limited amount of things they can affect, then it tends to spiral outwards. So do little things. Like with my 3-year-old, we've made a big game of washing our hands. We try different songs every day, everything like that, to kind of help them take that kind of ownership of it.
Yes. We're so used to going to the movie, going for dinner, and all those different things that we used to do before. How do we maintain social relationship during this time?
Well, we are in a really good kind of condition for that right now. We're in this kind of technological era that we're in. You can do things like this. We can Skype when I can't be in the studio, or you can talk with friends and family. I know we say a lot about staying off of social media for things around the pandemic, but it is an absolute boon in terms of social connection. It's a great opportunity for people to see what you're doing and how you're doing it. We have my kids have daily Skype calls with their grandparents, where they get to check in, they see their grandparents okay, that everyone's doing all right, and it's a fantastic opportunity for that. So it's a great chance to reach out, and just make sure that everyone, that they're doing all right, and they can see that you're doing all right, and that can have a huge calming effect on people as well. There's also options out there for you to do shared activities that you'd normally be doing together in person, but separately. You can watch a movie together just over the phone. You watch the same movie, different locations. It's not the same, but it can definitely kind of help reach that connection that a lot of people feel they're missing.
And just to, you mentioned a few things. What are a few other things that people can do while they're at home to reduce anxiety?
Well, I talked previously about like this sphere of control and kind of looking at the things that you can affect. And the problem with the news is it is a big global situation. So people tend to kind of look at things that they can't really impact or affect. But while you're in your house, you can look at things that you can actually do and you can actually help and fix it. And this might be a good time to find some kind of form of distraction, something that will, a positive kind of thing. So a lot of people have talked about making a routine or keeping with your current routine that you already had, just adapting it to being in the house. And that's really, really positive, because that that kind of structure and lifestyle can kind of help keep those kind of anxious and negative thoughts at bay.
How do you deal with the feeling of feeling fearful to go outside?
Oh, yeah, that's really big. I mean, it's one of those scenarios where clinically, the fear of going outside is agoraphobia, where people are worried about being in large social gatherings because it's a situation that they can't control. They worry they may become tense or anxious or embarrassed and be unable to get to a place where they feel like they have some control. With the current situation, we're being told not to go outside, to stay inside and just lock all your doors and windows. So it's another one of those things where you can take small steps. Maybe if you're absolutely petrified, it's just opening your window, or maybe it's just opening the door and looking outside, realizing that, I mean, although everything is kind of, messaging can be very, very scary, it's still safe to walk outdoors. You just need to kind of look at yourself and see where that anxiety is coming from and see what you can do to address that.
So if you're showing symptoms of COVID-19 and you're waiting a test result, how do you cope until you get that result?
It's a very scary kind of idea. It can mean 14 days of isolation from everyone you know. But it is another one of those things that whatever that test result is going to come back, it's not something necessarily anything you can do or think can affect that. You have to think about what you can change in that kind of scenario. You could think about the preparations that you've already made or what you can adapt so that you can be in isolation and keep your family safe. You can think about the positives of it as well, about how, I mean, hopefully you're in a situation where that's something you can do and that can work. It can also be helpful to reach out for help. There's online counseling that's available that people can access without ever needing to be in contact with a person. You could go to, there's Big White Wall, which is an online counseling, and there's also Bounce Back, which is run by CMHA. You can find those both online, and they're fantastic resources. They offer group counseling and in over the phone one-on-one counseling, and also workbooks and tools that people can use to deal with that kind of anxiety that's kind of built for your personal situation.
What can we do to reach out and help support our seniors from a distance?
In terms of seniors, like people that you have a connection with, very much just calling, checking in with them, letting them know that people care for them. It can be a bit negative to be in a scenario like this because they're being told that it is very, very scary for them, and absolutely it is. So just let them know that they're valued, that you want to make sure they're safe and stay in touch.
Is there any other tips that you could give to the community in regards to coping with what's going on right now?
Well, absolutely. I mean, like I had said before, I think your best bet when you're dealing with any kind of anxiety is to reach out and get in touch with a mental health professional if you find that it's impacting your life. In a scenario like this, a lot of organizations are operating kind of on smaller scales, but you can still get in touch and you can still talk with people. You also have online resources, like I mentioned, like Big White Wall Canada and Bounce Back, which are fantastic resources in terms of being able to get in touch and talk through issues and problems you might be having.
Yes, and it's always good to know that it's okay to not feel okay, and it's okay to reach out for support and the help that you need so that you can get through it, because it's not an easy thing what's going on right now. It's hard for all of us, so if we can help to support each other, it will make a big difference. We're going to take a quick break. When we return, Leslie Motts from Lakeridge Health will join me with some medical tips and information about COVID-19.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
As a senior support coordinator at Durham Regional Police, I have the privilege of working with seniors and the organizations that serve them. Join me, Sergeant Deborah Anderton, along with Constable Daryl Rice on Seniors Talk, as we put the spotlight on the issues that matter most to seniors and their families: safety, wellness, and family responsibilities are just some of the challenges that we'll tackle on Seniors Talk, only on Rogers TV.
Welcome back to the show. Joining me via Skype is Leslie Motts from Lakeridge Health. Welcome to the show. Leslie's joining us by Skype because we're practicing social distancing. What are the symptoms of COVID-19?
Hi, Carion. Thanks for having me. Symptoms of COVID-19 are very reflective of common cold and flu and illness. So coughing, fever, some shortness of breath, and general malaise, achy, some really standard symptoms that we've probably all experienced over our lifetime as we've recovered through colds and other flu-like illnesses. Where it becomes a little bit different is when there's an increasing shortness of breath, where some level of medical intervention is required. That is when you probably need to seek some primary care support or call your Durham Region Public Health.
So what should community members do if they have COVID-19 symptoms?
There's a couple of options for folks. One of our most popular options at this point is to go online to Lakeridge Health website. There is a self-assessment form that can be completed. It is submitted into our COVID-19 assessment clinic, where folks who submit can expect to receive a response within approximately 24 hours with further direction. That may mean stay home, it may mean a virtual visit, it may mean to come in and be assessed further. So that is one option. The other option is to contact your primary care physician. Many are doing very innovative ways of seeing their patients as well as in person. And the third and always open is Durham Region Public Health hotline. They will also have a conversation and help you self-assess and direct accordingly.
So how can community members get tested for COVID-19?
There's a very clear criteria for who is being tested. So it's actually determined by a medical physician at this point. These are guidelines that have been developed and implemented across all of Ontario. So there isn't a self-referral for testing. There's a self-referral for assessment, and then our clinicians will decide if testing is required as a result of the provincial criteria.
I know we're all nervous about touching stuff and going outside. Mm-hmm. How long does the virus last on surfaces, and how do you clean these surfaces?
You know, this virus, COVID-19, is fairly new, as you can appreciate, so there's still lots of research going on, a few opinions out there, anywhere from the virus lasting on surfaces from hours to up to 8 days. So understanding that the science is not perfect yet, our recommendation is to trust that it can live for a very long time on surfaces and therefore needs appropriate cleaning. Appropriate cleaning truly is your household cleaners that can, ideally with a little bit of bleach, will certainly take care of it. So your household wipes and your household products are more than adequate for cleaning. And I would strongly encourage folks, as they're thinking about cleaning, to really pay attention to what you touch. We have very common touch points within all of our homes. Your TV converter, your stove, your microwave handles, all your doorknobs. So give really serious consideration and pay attention to what you touch, and that will very clearly drive where you ought to be cleaning on a more frequent basis.
Now, like myself, when I go out and get groceries for my family and I bring it in, I actually sanitize my groceries. Is that something people should be doing as a precaution, or is that like going overboard?
There hasn't been any guidance around sanitizing things entering your home. Mm-hmm. So I would say that, with a reasonable level, make sure your hands are clean. That is the key to all of your daily activity. The more frequently you wash your hands, the cleaning and sanitizing other things becomes less important. Because if your hands are clean and you're not touching your face, then it's okay to be touching things as long as you're cleaning frequently after touch.
It's so hard not to touch your face because we touch our faces so often. How do you stop the spread of the germs and keep your family healthy at the same time?
Lots of strategies, certainly lots of public education going on around social distancing. That's certainly very important. So you may be hearing things around 1 meter. It's certainly recommended in Ontario and Canada, the 2 meter or 6 foot rule. So keep your distance with all general public. You will see a lot of that happening out there right now, which is really, really great for us. We really are hoping to flatten the curve, and this is a really big strategy for doing that. So the 6 foot rule, so the span of your arms, and add another couple feet, and that should be adequate. Hand washing, I cannot stress how important hand washing is. Every time we touch something, if we wash our hands, it will significantly decrease the opportunities for spread. Keeping yourself well is very, very important in these times, not only because of the virus, but because of the stress of the environment right now. So some extra care to our wellness. Still seek some fresh air, whether it be in your backyard or somewhere where there is not public crowds. Make sure that you take time for walks if you are not quarantined. So really take care of ourselves. Which will enable us to take care of each other as long as we're not unwell. So public distancing, hand washing, cough etiquette. Please make sure you either sneeze and cough into your arm, or if you're sneezing and coughing into a tissue, dispose of it immediately and then wash your hands. And that is how we're going to flatten the curve and keep each other safe.
I think we're all getting used to the fact that we're alone and we're getting to know ourselves a lot better than before. Tell me about the self-isolation protocol.
So self-isolation at this point, the recommendation is if you have either if you've been advised by a medical professional or Durham Region Health to self-isolate, it would generally be a 14-day rule. That does not mean that you cannot have other people in your home. It still means you need to be very, very smart about how you do that. But you stay in your home. Ideally, you will optimize your friends and family to have things not only be delivered for you so that you're comfortable, but also so that you can ensure that you're still maintaining a level of social interaction. We all know how very important that is. So it's important that we figure out different strategies for ensuring we are still interacting and getting conversation and stimulation as much as we need it. We really want to ask our communities to reach out. We know that isolated folks, especially the elderly population, will not do well. So it's important that we check in, that we offer, a phone call, that we offer some FaceTime, ways to make sure that people know that we are still connecting as humans, that we support each other, and that we're here for each other.
Toilet paper is something we can't find anywhere for some reason. Should we be stocking up on supplies, foods, medication? Is that something that we should be doing?
The public health and the province is discouraging product hoarding. There's a high level of confidence that products will continue to be available in Ontario, including toilet paper and tissues. Certainly, I've experienced the very same thing in my local grocery stores as well. The recommendation is just to keep a healthy stock, but not to get overburdened with stocking stuff, because we're receiving very clear information that there's not going to be any significant disruption to the supply chain. So just to be smart, there is some recommendations to going to our pharmacies right now across the province to try and ensure that folks are receiving enough medication, but not so much that, in fact, we actually cause some sort of shortage that otherwise would not exist. So you will find that you can have a conversation with your pharmacist, and she will certainly give you advice as well. But at this point, I think it's important to be reassured that the supply chain for all of these products is well intact, and we're unaware of any shortage where people aren't able to get what they need at this point.
So there's a cry all around the world for masks, hand sanitizer, ventilation. Does the hospital have adequate supplies?
I want to start off by reassuring you, as a healthcare facility and serving Durham Region, we plan all year long for emergencies. So we are now putting our planning to the ultimate test. So this time we do have adequate supplies, we have adequate capacity for patients, we have adequate manpower. We know as time goes on, if this continues to worsen for a while, that will be challenged. But at this point, we feel we have enough backup plans in place that we will not disrupt access to care and that we are well positioned to serve the community.
How are you protecting staff?
Thanks. That's a really important question. We are protecting staff. There's provincial guidelines around protective apparel. We are following those guidelines. We're providing a lot of education to our teams on how to use that safely, when to use it, and ensuring it's available for them. So that is first and foremost, and a really passionate topic for our providers. So we're working very diligently daily to ensure that that is all in place and that we have supports where they need for our staff. This is a very anxious time for our providers, certainly as well, and they have families at home that we need to give consideration to. So in addition to ensuring that there is adequate supply, we also have employee assistance in place and other supports to not only physically but emotionally support our teams as they work through this with us and continue to be prepared to meet the needs of the community.
So how are you protecting patients who come into the hospital for regular emergency care?
So we have lots of strategies in place. I think the first thing as a patient entering any one of our emergency departments at Lakeridge Health, you can expect to be met by a screener who's going to ask you some key questions around symptoms, around travel, around any sort of perhaps connections you've had with other folks who may be symptomatic. That is the first point of screening. From that point on, we have very rigorous processes to ensure that people in our waiting rooms and our caregivers, as well as our patients and their families, are managed from that point on quite safely, so that there is no opportunity for exposure beyond the entrance doors. So we have a very clear process in place as well once you hit our triage nurses who will, it may feel like, ask you a few of the same questions. Those are meant to, and intended to be that way because we do not take our safety requirements lightly, and so we have built in lots of safety nets to ensure that we are asking questions and getting the most relevant information to ensure we can offer safe care for our patients.
And that's very important. Where can you go online to access reliable information about COVID-19?
There are several websites I would certainly encourage folks to look at. There's an abundance of information out there. Please, I encourage you to go to the reliable sites. By social media and a lot of other venues can be confusing and cause anxiety. Certainly, Durham Region Public Health website is one that I would strongly encourage. The Ministry of Health keeps their documents online and up to date as well. And of course, Lakeridge Health works very hard to ensure that the information is available for our community. So our website is also full of a lot of really valuable information for our communities to access.
And that will help you to have the accurate information so that you're not stressed out and you'll be able to manage this a lot better. We hope, thank you so much, Leslie, for joining us. We hope today's show has answered some of your questions you may have with regards to COVID-19 to help you and your family stay safe. That's all the time we have for today's episode of Health 180 with Carion and Fenn. Thank you to Alec from CMHA Durham, Leslie at Lakeridge Health, and you for joining us. And remember, together we're stronger.
Call the Rogers TV viewer response line, email us, or connect with us on social media.